And ladies and gentlemen, thank you for standing by. Welcome to the Los Angeles County COVID-19 update. At this time, all participants are in a listen-only mode. Later, we will conduct a question and answer session. Instructions will be given at that time. If you should require assistance during the call, please press star and then 0. This time, I'd like to turn the conference over to our host, Supervisor Catherine Barger. Please go ahead.
Thank you. I'm Supervisor Catherine Barger, Chair of the Los Angeles County Board of Supervisors. Today, we will be providing an update on our work to protect the health of our homeless population, who are among the highest at risk of infection and serious illness due to COVID-19. Though we do not yet have any reported incidents of coronavirus among people experiencing homelessness, it is a priority for the county and its partners to prepare, prevent, and care for this community as we care for all of our communities. It is imperative that we find housing and service solutions that serve the unique needs of those experiencing homelessness in light of this public health crisis. The Office of Emergency Management has designated the Los Angeles Homeless Services Authority, known as LAHSA, as the lead agency to work relating to people experiencing homelessness. The county's Emergency Operations Center is working to fulfill an increased number of resource requests for homeless shelters, including a request for 14,000 cot covers, 18,000 blankets, and 98,000 towels. We are also working on plans to assign additional medical sheltering sites, providing transportation, food, laundry services, and security services. The goal is to secure 2,000 beds for quarantine isolation of individuals who have tested positive or who are suspected of being positive for COVID-19. The Department of Mental Health is staffing new shelters coming online in the city of Los Angeles, and staff from our Housing for Health division are helping medical sheltering come online. We are also working with our philanthropic partners and connecting the needs of county residents with the generosity and support of organizations such as the United Way of Greater Los Angeles and the California Community Foundation, which have come together to support individuals experiencing homelessness. The philanthropic effort focuses on supporting unsheltered residents, low-income individuals, students, and families at risk of homelessness or hardships. We will have LAHSA's Executive Director Heidi Marston speak more today about our outreach and care for people experiencing homelessness. In the meantime, I would like to invite Supervisor Hilda Solis, Chair Pro Tem, to say a few words. Thank you.
Good afternoon, everyone, and thank you. I'm Supervisor Hilda Solis, Chair Pro Tem for the 1st District. I want to thank Chairwoman Catherine Barger and the entire County Board of Supervisors and all of our county departments for working tirelessly with many of our partners to provide guidance for our homeless services providers and the many people that they serve, people experiencing homelessness. Our homeless service providers and outreach teams are considered essential workers during the COVID-19 health emergency, and they continue carrying out important work to help the most vulnerable individuals. Information about practicing social distancing, hand washing, and good hygiene has been shared with individuals and families in our interim housing facilities. Our homeless outreach teams, which include LAHSA, DHS, DMH, and the Sheriff's host teams, are also connecting every day with unsheltered individuals to offer shelter and services, especially to the most at risk, those that are 55 or older or who have an underlying medical condition. I want to talk briefly about our probation camps. I want to assure you that we're also working to ensure the health and safety of our youth in the juvenile halls and probation camps. And that's why I'll be introducing a motion to reduce any crowding in our juvenile facilities, as well as seeking to increase access to social distancing and increase hygiene practices as recommended by our public health experts. I recently spoke to our interim probation chief, Ray Leyva, and he assures me that they're moving in the direction to practice social distancing, regular hand washing, and good hygiene. During the duration of our Safer at Home order, we're working to keep all of our youth safe, healthy, wherever they are, and to continue to create an environment where learning and education can take place during these times. Also, the county continues working with the City of LA, the state, the private partners to assess properties throughout the county that could serve as interim shelter. This is a high priority, as you know, for LA County. This is a different objective than identifying quarantine and isolation sites for confirmed COVID-19 cases or people who have had contact with a confirmed COVID-19 patient. Expanding shelter countywide is the goal of the county and has already been working toward before the COVID-19 crisis, but now more than ever, we have an expedited timeline. As we work to stand up new interim housing for people experiencing homelessness, we also need donations, as was stated by our chairwoman. Some urgent items that are needed: clothes, towels, blankets, food, and water. Additionally, the United Way of Greater LA has set up a pandemic relief fund to help get additional resources and support for LA County's unsheltered residents. If you'd like to make a donation, please visit unitedwayla.org. And for more information about help that you might need, call 211. Want to talk about food security? During this time, it's critical to inform those who may be faced with food insecurity that it's easy to apply for CalFresh benefits. The CalFresh program helps individuals and families afford nutritious food, including fruits and vegetables and other healthy options. CalFresh food benefits are provided on an electronic benefits transfer EBT debit card and can be used at any grocery store and farmers market that accepts EBT cards. Also, individuals receiving CalFresh benefits who are homeless, have a disability, or are age 60 or older can use the EBT card to purchase prepared meals from participating restaurants through the CalFresh Restaurant Meals Program. Applying for CalFresh is easy. You can do it online or by phone. For more information, call 866-613-3777 or go online www.getcalfresh.org. Finally, I want to thank Governor Gavin Newsom for his continued support as the county tackles this health emergency. Governor Newsom has approved allocating more than $42 million for the LA region in emergency homeless housing, assistance, and prevention. This includes $10.6 million for Los Angeles County. This funding will provide essential support for LA County, the City of LA, the City of Long Beach, and continuums of care to provide important care, shelter, housing for our homeless population during and beyond this crisis. Thank you. With that, I am pleased to welcome Dr. Barbara Ferrer, our Director of Public Health.
Good afternoon, everyone, and thank you so much, Supervisor Solis and Supervisor Barger, for your outstanding leadership during these very, very difficult times. I feel like our county is in the best hands possible because we have an amazing board, and your leadership during this really what is a long-standing crisis has been absolutely essential to us being able to have a path forward that allows us to implement appropriate strategies. I also want to thank all of the leadership throughout the county and the cities who have been remarkable examples of collaboration and cooperation during this time. This is actually what's absolutely necessary for us to be able to provide appropriate services to the more than 10 million people that call LA County their homes. I want to update you on our current status, and once again, I'm very saddened to have to report today 3 additional deaths. All 3 individuals were over the age of 65 and had underlying health conditions. This brings the number of deaths to 13 in LA County. I want to note that we're no longer including in this count the death of the young person we reported yesterday because we have asked CDC to complete an investigation on that case. The family and the friends who are mourning these losses, you're very much in our thoughts and prayers, and we are so very sorry for your loss. Today we're also reporting 138 new cases. Over the last 48 hours, there have been 266 new cases, which brings the total of new cases in LA County to 799 cases. This includes 28 cases that are reported by our partners in the city of Long Beach and 7 cases reported by the city of Pasadena. Fully 80% of all positive cases in LA County are happening amongst people between the ages of 18 and 65, with 40% occurring in young people or younger people between the ages of 18 and 40. 160 people who have tested positive have at some point in time been hospitalized, and this amounts to 20% of all of our positive cases. 1% of people in LA County who have been diagnosed as positive with COVID-19 have in fact passed away. And in the United States, the mortality rate is at about 1.5%. I want to note that this is a higher rate than what we experience annually for influenza. 44 people are currently hospitalized, and 77% of these people are in the ICU. I'm noting these numbers to just make sure everyone understands that the people who are hospitalized are often very sick and they need to use intensive services in our hospitals. Of those who are currently hospitalized, 4 are in their 30s and 26 are 60 or older. 60% of the patients in the ICU are older than 60. As always, confirmed cases are being isolated and close contacts are quarantined. And as a reminder, we post detailed information about the cases on our website, publichealth.lacounty.gov. We're currently investigating 12 different institutional settings that have potential outbreaks. All of these settings have at least 1 case of a person testing positive for COVID-19. Our teams are there to ensure that appropriate infection control measures are adhered to and that where appropriate, quarantine orders are issued for both residents of the facilities and or staff. We'll be updating on a regular basis case reports on these settings, and where there's information that indicates that there are 3 or more positive cases at an institutional setting that we're investigating, we will include that information on our website. I want people to know that we can continue to provide essential technical assistance to institutional settings, and this includes long-term care facilities and nursing homes. We already did a round where we provided technical assistance to all 320 shelters and interim housing facilities. We recently did about 315 nursing homes, skilled nursing homes, and long-term care facilities. And yesterday we trained 900 people who are managers and staff at congregate living facilities on infection control protocols and practices at their sites. As of yesterday, over 6,300 people have been tested in LA County, and 11% of those tested were positive. While we're not seeing the same rate of acceleration in cases as New York City, this does not mean that we won't see many more cases and that we won't in fact experience an acceleration once testing capacity increases. I want to really thank Dr. Kazan. He's making amazing strides in improving our capacity to test. But I also want to remind all of us that testing remains limited. And increasing our capacity to test means not only that we need to have enough testing available, but we need to be able to get those results in a timely way. And we still remain limited in both ways. So we're continuing to ask that testing be prioritized for people who are symptomatic and for whom a clinical provider has determined that testing is appropriate. As a reminder, in these times that are less than ideal, we don't have all the testing we wish we had. And in fact, we're working hard to make sure that our healthcare workers have all of the equipment that they need to be able to practice life-saving medicine in all of the places where they're practicing. We all need to do our part as well. Social distancing remains a critically important strategy for slowing down the spread of COVID-19. The other strategy that's really important for us to adhere to are isolation and quarantine orders. And I want to announce that today the LA County Health Officer will be issuing a public order that requires the self-isolation of any person who's tested positive for COVID-19 or is presumed by their physician or clinician to be positive for COVID-19, and also orders the quarantine for all close contacts. That includes household members and caregivers. So if you've been tested for COVID-19 and you're waiting for your test results, or you've been told by a provider that you should presume that you're positive for COVID-19, we ask that you follow the directives to self-isolate. This means staying at home for at least 7 days and until you're fever and symptom-free for 72 hours. Do not leave your home. Please do not leave your home unless it's for a medical appointment. We ask that you notify all of your close contacts that you have COVID-19 or are likely to have COVID-19 so that your close contacts can in fact begin their quarantine. And as a reminder, close contacts include intimate partners, caregivers, people who live in your home, or people with whom you spend a significant amount of time each day face to face with less than 6 feet apart. As much as possible, we ask while you are self-isolating, you stay away from other people in your home and you use your own bathroom. The public order also requires that folks who are close contacts quarantine themselves. And a quarantine means something similar, but for a longer period of time. So while people who are ill and have a positive diagnosis for COVID-19 or are presumed to be positive for COVID-19 need to remain home for at least 7 days and 3 additional days that they're symptom-free. That means no fever, no using fever-reducing medication to count as no fever. For people who are quarantined, it's a 14-day quarantine. You must stay home, isolated from others for a 14-day period. That's the incubation period for COVID-19. Even if you were to get tested during that period and your test is negative, you still have to stay home the entire 14-day period. It's really important that people understand 14 days is what's required because it can take up to 14 days for you to develop any symptoms of COVID-19 from your exposure. If you develop symptoms, you immediately move into needing now to be isolated, and you have an additional 7 days that you must stay isolated, and that includes you must be 3 days free from fever and symptoms before you can, in fact, leave your household. I'm trying to give as much advice as I can on this and what it means to quarantine and isolate, because even if you're not positive now and you have no close contact with people who are positive, we're asking every single resident in LA County to be prepared to isolate and or to quarantine. And that means have your plans in place, because when you're quarantined or isolated, you cannot go to the grocery store, you cannot go to the pharmacy. And we ask that you have plans in place, that you ask for help if you need help from others in your friends, your neighbors, your family, to make sure that you can get your necessities so that you, in fact, are able to stay home, isolated and or quarantined. Please feel free to call 211 if you need assistance or you're having trouble figuring out how this would apply to you if you're already being asked to quarantine and or isolate. I want us all to keep hope. I think, from my perspective, the vast majority of Angelinos are doing everything they can to practice social distancing, to stay home if they're not essential workers, and to support each other. And I bless all of you for being part of this effort. And I ask of those of you who are still having trouble coming into compliance with social distancing requirements. People, unfortunately, are dying in our communities, and people are very, very sick from COVID-19. And you can do your part. You are a person, wherever you are, who can possibly infect others, and we ask you to take every step possible to make sure that's not happening. So now I want to introduce Dr. Christina Galli from the Department of Health Services.
Good afternoon. I'm Dr. Christina Galley, the Director of the Department of Health Services. First, I want to extend my thanks to all those who are out there working on the front lines, the public health workers, the healthcare workers, first responders. I know you are all going above and beyond. It is a great deal of work, and your energy and your passion and your mission and your enthusiasm is so much appreciated and valued, and I want to extend my thanks. I know this has a large toll on you emotionally and physically, and we're grateful for your service. In response to some questions we've received from the media, I wanted to start with just a quick overview of the role that the Department of Health Services is playing in the COVID-19 response. First, we provide direct care services through a variety of clinical locations across the county. We have our 4 public hospitals that are located countywide. We have 25 standalone health clinics that continue to provide services and are open to those who need care. We also offer clinical services to the inmates in the LA County jail population, as well as to juveniles in the juvenile halls and camps. In addition, the Department of Health Services runs the EMS agency, which plays a key role in helping to coordinate both pre-hospital care and emergency level care and acute care services across all of the hospitals in the county, both public and private. They serve as the disaster resource coordinators across the county and are actively distributing supplies, including personal protective equipment, ventilators, and other supplies from state and national stockpiles. Next, our Housing for Health division has a very major role, and you'll hear a little bit more about housing and homelessness services later in this press briefing. Housing for Health offers the interim and permanent supportive housing services to individuals experiencing homelessness across the county. With respect to COVID-19, our Housing for Health team is active in providing technical assistance and training to street outreach workers, as well as staff at all of the interim and permanent supportive housing sites in the county. They are also very active in setting up the quarantine and isolation sites that are being set up for persons experiencing homelessness. And finally, our Office of Diversion and Reentry, referred to as ODR, they also work in close consultation with Correctional Health Services and our Housing for Health team on identifying a select set of individuals, predominantly those who are medically fragile or who have serious mental illness, who can be safely moved to community-based treatment and housing sites upon release from the jail system or from juvenile halls and camps. Next, I'll turn to some brief stats on the bed capacity numbers in the area. Here's the latest information. There are, again, 84 acute care hospitals across the county. There are 23,000 total acute care beds, including 2,200 ICU beds. Across all of the county acute care hospitals, as of today, there were 1,500 open beds, including 220 open ICU beds, with 100% of hospitals reporting. This is a daily hospital report that is coordinated through the EMS agency, and we will soon be putting this information on a daily basis on our website so people can access it directly. Among the 4 directly operated DHS hospitals, we have currently 1,400 staffed beds. The census is 900 for a 64% occupancy. That leaves 500 beds that are currently open, including 65 open ICU beds. We're also actively tracking available ventilators, and with the hospitals reporting again self-reported data, there are currently 820 available ventilators for use on patients who require them. Regarding hospitalizations, as Dr. Farrar just reported, there are 160 of the 799 patients who have required hospitalization at this point in time in Los Angeles County, for an overall hospitalization rate of 20%. Within the DHS system, we currently have 4 individuals who have tested positive for COVID-19 who are in the DHS hospitals. This includes 2 who are in ICU level care and 2 who don't require ICU level care. There are no inmates in the LA County jail population who have tested positive for COVID-19 to date. There are also an additional 71 individuals currently in the DHS hospitals who are currently under investigation for possibly having COVID-19 and are awaiting test results. We have started asking all of the private hospitals across LA County to report on a daily basis their number of COVID-19 positive patients, as well as persons under investigation, along with their available bed number, and we will report this information in aggregate based on availability of numbers. If you have any specific questions about individual hospitals' data, it would be best to reach out to them directly. In terms of surge planning efforts, the county has developed a 5-stage surge planning effort in order to increase the capacity of acute care beds across the county. This includes making sure that we have increased number of beds available for individuals who are COVID-19 positive, as well as making sure we maintain bed availability for individuals who require hospitalization for things other than COVID-19. We are working on the staffing and supplies, as well as other resources and systems needed to support these beds, and are appreciative of all of the partnerships that have been in place to help support these efforts. The plan, as I have mentioned before, includes both freeing up beds, adding existing beds within general acute care hospitals, and also standing up alternative care sites, including mobile hospital structures, to be able to accommodate what might be an increase in surge in patients in the coming days or weeks. With respect to supply chain, we highly prioritize the safety of our workforce and our patients, and are actively following all public health guidance with respect to provision of personal protective equipment. On a daily basis, the EMS agency distributes personal protective equipment across a range of providers, including hospitals, clinics, emergency responders, fire personnel, public safety personnel, and they are managing several hundred requests on a weekly basis. We're grateful to our federal partners, including FEMA, as well as various state partners, for helping us to gain access to personal protective equipment, as well as other supplies such as ventilators. We have multiple orders that are in the process of coming in, and we are seeing the stocks of several of those pieces of equipment and supplies increase on a daily basis. In closing, I just want to again extend my thanks to all those across the county, the cities, the state, who are banding together and working in a unified and coordinated fashion to make sure that we can care for individuals with COVID-19. I'll end with just 2 final pleas very quickly. One is, please continue to give blood. I'm grateful to those who have stepped up and gone to blood donation centers and helped to stabilize the blood supply for our hospitals. Things are slightly better, but we do still need blood donations, and I would encourage people who are healthy and able to do so. Second, please do follow all of the social distancing guidelines put forward by state and local departments of public health. Stay at home if you can. Isolate and quarantine according to the directions given by public health authorities. This is still the single most important thing that can be done to flatten the curve and make sure that we preserve and protect the lives of those around us. With that, I will turn it over to Heidi Marston, the Interim Executive Director of the Los Angeles Homeless Services Authority. Thank you.
Thank you. Good afternoon. LASA and our partners in the homeless response system are working around the clock to ensure the safety of all of our individuals who are experiencing homelessness amidst this crisis in Los Angeles County. At LASA, our primary focus is to expand opportunities for immediate housing and shelter solutions for people experiencing homelessness. In partnership with the city and the county of Los Angeles, we've set up 8 sites, bringing online nearly 350 new shelter beds just in Los Angeles City alone, with a plan to operationalize up to 42 additional sites. These sites came online in less than a week. We're also working close with the county and our partners to create beds specifically for isolation and quarantine that can be made available to individuals who are experiencing homelessness should they need to isolate or quarantine. As of today, there are nearly 900 hotel rooms available and beds that have been secured for this purpose. LASA is also focused on maintaining capacity through our existing interim housing and permanent supportive housing sites. This means we're working very closely with our nonprofit provider partners to ensure they have the supplies, the resource, the training, and the assistance they need to maintain safe operations. On any given night in LA County, we have about 7,300 shelter beds available for people experiencing homelessness. And since this crisis emerged, we've been successful in securing an additional 900 shelter beds through our winter shelter programs that will be operational 24 hours a day, at least through the end of April. We're also supporting our nonprofit partners in adapting their current shelter to the new regulations to ensure that social distancing is maintained in our shelters. For those who haven't come inside yet, we're doing everything we can to take preventative measures at encampments and doing everything we can to get people indoors for their safety. Partnering with leadership across the county and the city of LA, we've placed more than 300 mobile hygiene stations in 18 mobile shower locations that are operating for people who are living on the street. LASA has created a portal on our website, lasa.org, that has an interactive map to show people where these resources are located to ensure that they have access to that information. Our outreach teams are also focused on locating unsheltered individuals who are deemed highly vulnerable, meaning over the age of 55 and or have underlying health conditions, to ensure we're doing everything we can to get them inside so they minimize and decrease the risk of their exposure. As I said, we've compiled an extensive resource portal on lasa.org that contains best practices, resource guides, training for outreach workers and providers, and information on how you can receive help if you need help, as well as information in how you can help in this effort to ensure that we are doing everything we can to protect our most vulnerable neighbors. We're committed to serving our unhoused neighbors with more than 200 outreach workers across the county who are engaging with folks every day to make sure they know the resources available to them, and working closely across our system to support our homeless system and what it needs to deliver resources and address this crisis. And with that, I will open it up to questions for the group.
Thank you. And ladies and gentlemen, if you do wish to ask a question, please press 1 and then 0 on your keypad. You can withdraw your question at any time by repeating the 1-0 command. And if you're using a speakerphone, please pick up a handset before pressing numbers. Once again, it's 1-0.
First question.
Now it comes, one moment here. It'll come from the line of Haley Winslow with Fox 11 News. Please go ahead.
Hi there. Thank you for everything you guys are doing. Just wondering, could you guys elaborate at all anymore on why the teenage death may be related to COVID-19 is complicated?
Sure. One moment, Dr. Ferrer will come up.
Yeah, thanks so much for that question. On further investigation of the death of a young person under the age of 18 that we announced yesterday, there were extenuating circumstances that pointed to an alternative diagnosis as well. So given that there is a possibility of 2 diagnoses as causing the death, we've asked the Centers for Disease Control in Atlanta to perform some additional testing so that we can, with all certainty, note what the cause of death was. And we appreciate, the public's patience. Again, our heartfelt prayers for the family as they too await further clarification on the actual cause of death.
Thank you. Next question.
And that'll come from the line with Dave Lopez with KTVS. Please go ahead.
Yes, Doctor, two quick questions, if I may. The numbers in New York, and I hate to keep bringing that up, but I guess that's a very critical barometer. 5,100 new cases in one day, 75 more deaths. Should we expect that to happen in Los Angeles? And if it doesn't happen, say, in the next week, is it a sign that we are doing everything humanly possible to stop this surge?
I wish I could say with all certainty that's where we're going, and more likely I would love to be able to say with all certainty that's where we're not going. And I can say neither. What I do say is that New York and Italy are examples where there were both very rapid accelerations in the number of new cases, and we would be foolish to not prepare for a similar scenario here in LA County. So what we need to do now is do everything we can to slow the spread while preparing for the fact that there may in fact be a similar acceleration of cases here in the county. I mean, obviously, we've gotten a dramatic increase in the number of cases as we've done more lab testing. If you look at the number of people that are tested in New York City, you'll see that they're testing lots more people than we're testing here. So we do need to be prepared as we test more people to see a rapid acceleration. We're going to do everything we can with all of you helping us to try to prevent that rapid acceleration, but we're certainly going to be prepared. Dr. Galley's leadership has been instrumental in making sure that our healthcare system can, in fact, be able to cope and manage with what we call surge capacity. But thank you.
And just one more quick point. The mayor on Monday said that we are entering a very critical week this week. Can you go into more detail than that? Is there something? Is there some numbers that you're trying to not hit to make that possible?
Well, every person that dies, every serious illness that this causes is heartbreaking. We talk about numbers, but these aren't numbers. These are people's lives. So I think, I can't speak for the mayor, but I think the sentiment is one that we all share, all of the leaders in the county, all of the elected officials, everyone that's working so hard right now, is to please understand that as soon as we know there are more positive cases, that means it's much more likely that it's easier to spread this infection. Obviously, if you have more people who are infected, then you can have those people infecting more people. And if you think about every person can infect 2 to 3 people, you understand why as soon as we hit 800 people who are infected, if we're not being particularly diligent, those 800 people will infect thousands and can infect thousands and thousands of more people as you start doing the math. So I think what's critical now is to understand we have a lot of people infected here in the county. We have people that we know are infected, and we have a lot of people we don't know that are infected. And that means everyone has the potential for either becoming infected or infecting others. And if we all walk through our days with that mindset, I think we'll be able to take the steps that we can to prevent, to slow down the spread.
Our next question here will come from the line of Steve Gregory with KFI. Please go ahead.
Hi, Barbara. Good afternoon. A couple quick ones. Regarding the teen, and you'll agree that this has got a lot of people very shaken up because this is presumably a healthy teenager. Do you have any suggestion or any evidence that if the teen had been tested earlier, because if I understand correctly, the COVID-19 had been diagnosed post-mortem, and I'm wondering if the teen had been tested positive earlier, would the treatment have been different, and would the success rate of recovery been better? Also, I wanted to know, in this misinformation campaign, a lot's being said about ibuprofen versus Tylenol, and I'm wondering if you might have a recommendation in that area.
So let me start with the first. So I'm not going to give any information about this particular case. That would be a HIPAA violation. But what I can say is, in general terms, that oftentimes what happens is there could be one diagnosis that's made when someone presents at the hospital, and that a patient, in fact, is treated for one diagnosis and is treated appropriately. And since this is a new virus, the idea that this virus can also infect a person who has another diagnosis is something we're starting to learn about, and that could be a possibility in any case. As somebody passes away, there could have been an identified cause for an illness, and then upon further inquiry, we would look to see if COVID-19 was also implicated. But I'm not going to get into the specifics about what happened with this young person, and I just want to respect both the person's privacy and the family's privacy. So I can't comment on the specific case. And I'm going to have Dr. Galley just talk about sort of Tylenol versus ibuprofen. I mean, one thing for sure we know, please no aspirin to reduce fever, but I haven't heard any debate about sort of Tylenol versus ibuprofen. So I'll let Dr. Galley see what she's heard on the clinical side.
Hi. I think that both medications are suitable, though obviously people's underlying clinical conditions can make a determination that one would be more appropriate than the other. So in the absence of better information at this point about the virus and how it is definitively best treated, it would be best to make all decisions regarding pharmaceuticals and medications that someone is taking if they feel ill in consultation with their personal provider.
Next question.
And that'll come from Claudia Prashupta with KNX. Please go ahead.
Hey, Claudia.
Hi. So hi. Good afternoon. I'm wondering if Mayor Garcetti is right that we're 6 to 12 days behind New York. Given the efforts that are underway to prepare for a surge. Where do you expect that we'll be, say, a week from now in terms of ICU beds, ventilators? I know ventilators have been ordered. I know the naval ship is coming. So do you have an estimate on where we'll be in that?
So Dr. Galley's here to answer that question for you.
Thank you.
Hi. So we're working on two things that speak to your question. One is we are working closely with the state and other academic institutions to put together a demand model for projections of bed need and ICU utilization, including ventilator needs that is specific to Los Angeles County as well as particular regions within the county. That remains a work in progress, but that data and information to the extent it can yield projections far enough out in the future will be instrumental in helping us to align the capacity with the demand. Simultaneously, we are ramping up the capacity. We know, as Dr. Ferrer referenced previously, that things can change very quickly. We've seen the cases in Italy, in Spain, in New York rise along a very rapid timeline. And while we know that we need to work on the projections, we also know that we need to not be foolish and we need to have that capacity ready to go if the cases start to spike. All hospitals have reduced their census through a variety of channels. Typically, hospitals can reduce their inpatient census by 15-20% through things like canceling elective surgeries and admissions. The Department of Health Services, our hospitals, are operating at 65% capacity right now because of those steps, as well as the reduction in ED visits that we've also simultaneously seen, and that trend I believe is true for a variety of reasons. At the same time, in addition to freeing up beds that would normally be occupied by non-COVID patients, hospitals have the ability, according to their disaster plans, to surge on-site acute care capacity, including ICU beds, anywhere from 20 to 40%. The ability of individual hospitals to do this greatly varies by hospital. We are working through the EMS agency in partnership with private hospitals across the county to help support them in implementing their surge plans. Hospitals can do this by doubling up single rooms, putting in a single room, or in a double room, putting 3 patients in a room. They can use post-acute care units, emergency departments, operating rooms, pre-op areas that are used to having critically ill patients in them, and they can use those for acute care bed capacity. We are also looking at bringing on delicensed beds back online. The California Department of Public Health has offered substantial regulatory flexibility in helping hospitals do so. This allows us to put in more acute beds, whether it's medical, surgical, or ICU level of care, into these previously delicensed areas. It also allows us to put online lower level of care beds for patients that cannot yet go home but no longer require acute care. And that facilitates moving the patients out of the regular units of the hospital into these new areas and making sure that the acute care bed capacity is reserved for patients who are truly acute. I've also, you mentioned the Mercy ship. That will bring on an additional 1,000 beds, 620 of those are lower level of care, 380 of those are acute care. Of those 380, 80 of those are ICU level of care. We're also looking at a number of additional federal and state options for increasing acute care bed capacity and working in partnership with a number of institutions. The governor has also recently announced that it has executed a lease for St. Vincent's Medical Center, and the county is working in partnership with the state as well as other private partners on a plan to be able to reopen that facility to provide acute care capacity. That particular hospital has a capacity of 380 beds. There's a number of different hospitals that we're looking to bring back online and other possibilities for doing mobile medical units that can be put in place in a variety of locations. Obviously, all these beds require supplies and they require staffing. So I've mentioned today, and we'll put the data online as soon as possible, there are a little over 800 ventilators that are currently available. EMS agency is working with FEMA as well as others to secure additional ventilators. We have a couple of hundred additional ventilators either delivered or on delivery with a delivery date anticipated soon, and we'll continue to increase those numbers as well as the other supplies and equipment that are needed to properly care for acute level patients.
This will be the last question.
Okay, that'll come from Carlos Grandi with Channel 7 Eyewitness News. Please go ahead.
Hey, Carlos.
Hi, how you doing? For Dr. Ferrer, she mentioned that you're investigating 12 settings of possible outbreaks. Can you explain what are those settings and where are they in the county?
Sure. I don't have the detailed information on where exactly they're in the county, but they're all over the county. So let me just say they are distributed throughout the entire county. These are primarily nursing home settings, but there's also at least one residential care facility and one group home. So I call, an institutional setting is a place where there are a large number of people receiving care and services. That could include, for example, a jail for us would be an institutional setting, as would be a shelter. None of those are on our list of places where we're currently investigating any kind of outbreak situation, but we do have primarily nursing homes where there's been at least one person. Oftentimes it is in fact an employee at a site that has tested positive. We're doing a full investigation, and that includes really quarantining most of the people at that facility, isolating, and this is a situation where we look very quickly for symptoms and we try to do rapid testing. I will say our lab retains capacity for all institutional investigations to be able to provide a rapid turnaround on testing. We can't be waiting 6 days for a test result when we have an institutional outbreak, and we don't. We actually process those and retain capacity at the public health lab to make sure we can turn this around quickly. All of the places where we're doing an investigation know that should there be 3 or more positive cases, we would actually be identifying those locations.
Now Supervisor Hilda Solis is going to give the remarks in Spanish. Supervisor Solis.
Buenas tardes a todos. Quiero primero dar las gracias a todos los supervisores que nos están apoyando esta día y cada día. También quiero agradecer a nuestros departamentos del condado que están trabajando para apoyar a los grupos comunitarios quienes están ayudando a los sin techo. Estos grupos comunitarios están haciendo todo lo posible para asegurar que los desamparados se mantengan seguros en este momento. Estos grupos comunitarios están diciendo a los sin techo que deben de mantener al menos 6 pies de los demás y que deben lavarse las manos muchas veces durante el día con jabón. El condado está haciendo todo lo posible para asegurar que los desamparados se conectan con los servicios que más necesitan. Especialmente están ayudando a los que corren más riesgo, los que tienen 55 años o más o que tienen una condición médica. Quiero decir también que queremos asegurarles que estamos trabajando para garantizar a la salud de nuestros jóvenes en los centros de menores. Voy a introducir una moción para bajar el número de menores en estos centros de menores. Así ellos pueden mantener 6 pies de distancia y seguir con las recomendaciones de expertos en salud pública. También quiero decir, el condado está trabajando con la ciudad de Los Ángeles, el estado de California y socios privados para buscar más lugares para los desamparados. También necesitamos donaciones. Quiero pedir que necesitamos donaciones para ayudar a las personas sin techo. En este momento, quiero decir también que necesitamos ropa, toallas, cobijas, comida y agua. Si desea hacer una donación, por favor, visita unitedwayla.org. O si no, pueden también llamar 211. También quiero hablar un poco durante este tiempo, les quiero recordar que es muy fácil a solicitar ayuda del programa que se llama CalFresh. El programa CalFresh ayuda a personas y familias de bajos recursos a comprar frutas, verduras y comida fresca. Si eres una persona sin techo o si tienes 60 años o más, pueden comprar comidas preparadas a través del programa de comidas en restaurantes CalFresh. Para más información, por favor, llama al Centro de Servicios de DPSS número 866-613-3777. Con eso también quiero felicitar a ustedes que esperamos que el gobernador también en este momento que nos está ayudando a abrir otros hospitales para ayudar a la gente que tienen este virus y le quiero agradecer a él. En este momento quiero introducir la doctora Barbara Ferrer, directora de Salud Pública. Muchas gracias.
Buenas tardes a todos. Quiero especialmente dar las gracias a la supervisora Solís y la supervisora Barger y todas las supervisoras del condado de Los Ángeles. Aquí estamos como unos líderes que han sido ejemplos notables de la posibilidad de colaboración durante este tiempo que es tan difícil. Para actualizarlo sobre nuestro estado actual, aquí estamos reportando hoy que estamos tristes porque tenemos 3 más muertes adicionales. Esto eleva el número total de muertes a 13 en el condado de Los Ángeles. La familia y los amigos que lloran están perdidas. Estas pérdidas están muy presentes en nuestros pensamientos y oraciones. Acerca de la muerte de la persona menor de 18 años, esperamos más pruebas en el Centro del Control de Enfermedades Nacional para confirmar el causa de muerte. Por este momento no estamos contando a este joven en la cuenta de las muertes del condado. Estamos hoy reportando 138 nuevos casos. En las últimas 48 horas había 276 casos nuevos y el número total de casos en el condado de Los Ángeles ahora es 799. 170 casos han sido en algún momento hospitalizados, el 20% de todos los casos positivos. El 1% de los casos positivos han morido. En los Estados Unidos la tasa de mortalidad es de 1.5%, bien cerca de lo que estamos experienciando aquí en el condado. 44 personas están en este momento hospitalizados. Tenemos 77% de estas personas están en el UCI. De los que están hospitalizados ahora, sabemos que la mayoría de estas personas tienen una edad más de 60 años. Los casos confirmados están siendo aislados y los contactos cercanos están en cuarentena. Puede ver la información más de los casos del condado de Los Ángeles en el sitio web del Departamento de Salud en publichealth.lacounty.gov. También estamos investigando en 12 entornos institucionales diferentes casos de enfermedades del COVID-19. Cuando tenemos más que 3 casos en una de estas instituciones, lo vamos a reportar ahora en el portal del web. También quiero darle las gracias a todo el mundo que está haciendo la distanciamiento social. Es bien importante que practicamos lo más que es posible a quedarnos 6 pies de toda la otra gente. Y a los que están trabajando porque son trabajadores esenciales, muchas gracias por su servicio. Y ahora vamos a abrir para preguntas. Oh, no. Jorge viene. ¿O José?
Gracias, doctora. Mucho gusto. Buenas tardes. Mi nombre es José Delgado y soy portavoz de la Autoridad de Asuntos de Gente Desamparada aquí en Los Ángeles. La autoridad y nuestros proveedores de servicios estamos en la obra, trabajando días largos y tomando pasos sin precedente para asegurar el bienestar de la gente y de la población indigente aquí en Los Ángeles. Nuestra meta es clara: la preparación hoy para mitigar y evitar la pérdida de vida mañana. Los siguientes son algunas de las medidas que hemos tomado hasta el momento. Hemos aumentado el número de albergues al beneficio de las personas adultas mayores y de otros grupos de mayor riesgo indigente. Hemos respondido de estas maneras porque sabemos que estando bajo techo estamos todos más seguros y estamos fuera de peligro. Hemos ampliado el plazo de cierre de los 2 albergues de invierno más allá del 31 de marzo. Normalmente estos hospedajes temporales, representando 900 camas, están en servicio 14 horas al día. Pero anticipando la necesidad, abrirán sus puertas las 24 horas. Continuamos colaborando con la ciudad y el condado de Los Ángeles para localizar recursos adicionales. Buscamos alargar la programación de estos sitios hasta el fin de abril. Se marcha adelante con el fin de iniciarse 42 albergues adicionales a través de la ciudad de Los Ángeles. Marcamos el primer paso este último fin de semana con el lanzamiento de los primeros 8 hospedajes. De hecho, laboramos a identificar 900 camas de aislamiento para aquella gente que exhibe síntomas asociados con el COVID-19. Nuestras intervenciones incluyen el uso de casas móviles proporcionadas por el Estado de California y el gobernador Newsom, y reclutamiento de propietarios de moteles para el uso de sus cuartos. Continuamos buscando opciones a nuestra disposición. Mientras tanto, hemos respondido apropiadamente, tomando medidas a nuestros albergues para ejercer, a lo más que se pueda, sana distancia. Para aquella gente que no ha dado con albergue, se continúa trabajando para evadir que se establezca una cadena de transmisión en esta población. Por parte del alcalde de Los Ángeles, el Consejo de la Ciudad de Los Ángeles y los supervisores del Condado de Los Ángeles, se han establecido más de 300 estaciones higiénicos, o sea, lavamanos, y 18 duchas móviles a través del condado. Tenemos equipos que en este momento se encargan de identificar clientes indigentes que pertenecen a grupos de mayor riesgo, aquellos con condiciones de salud crónica y adultos mayores. Esos equipos tienen el cargo de repartir información que los dirige a albergues más cercanos e información crítica. Somos una fuente de información. Hemos recopilado informes de varios expertos y orientación para aquellas personas que se encuentran sin hogar y para proveedores de servicios aquí en Los Ángeles. Todo esto se puede acceder a nuestra página de web. Si hay preguntas sobre el tipo de amparo disponible a usted o si desea buscar modos de poder contribuir a las obras, le pido que por favor visite nuestra página web www.lahsa.org. Muchísimas gracias. En este momento abrimos para preguntas. At this point, we'll start opening up for questions.
And the first question will come from Claudia Prosciutto. Please go ahead.
Hello.
Voy a preguntar en español. Hola.
Ándale,
¿Sí?
sí, estamos aquí. Listos.
Okay. Prefiero la respuesta en inglés, pero si tiene que ser en español, entiendo. Me gustaría saber si hay algún caso positivo en el Departamento de Salud Pública, en alguno de los trabajadores, y también SEIU 721 ha hecho una queja con Cal OSHA. Están diciendo que el condado no está allowing the stockpile of N95 masks, que no están sacando esas máscaras para que los usen los trabajadores en los hospitales. ¿Vale?
Es que estás diciendo que no se están distribuyendo las máscaras a las personas
No
que
están
trabajan.
distribuyendo las máscaras que tienen guardadas, exactamente. Si podrían responder estas dos preguntas,
Sí,
por favor.
ok. Ahorita viene la doctora Christina Galley.
Correct.
Inglés. Go ahead.
Oh, okay.
Hi, this is Christina Galley, the Director of Department of Health Services. The department always focuses on the safety of our workforce, and we're very concerned about all of the safety of our 7,000 nurses as well as the other ancillary staff, our providers. We are prioritizing obtaining additional personal protective equipment, including masks, both surgical masks and N95s. I know many people are aware about state and national shortages, and we have several stocks of those supplies on order with currently uncertain delivery dates. Despite that, I want people to absolutely understand that the department is in full compliance with all public health guidelines that's been put forward by the Centers for Disease Control, the California Department of Public Health, as well as guidance given out by the local LA County Department of Public Health. We're in active conversations with our workforce and our labor to understand how we can support them, make sure people understand what the guidelines are to protect their health and safety on the job as well as outside of the job when they're in the community. And we'll very happy to continue those conversations on an ongoing basis.
Si no hay más preguntas, vamos a terminar esta conferencia de prensa. Muchas gracias.
Claudia, te voy a contestar la pregunta sobre los casos positivos en los departamentos. No tenemos información sobre todos los departamentos en el condado que tienen casos positivos. Es bien importante que gente entienda que damos mucha información si hay casos en instituciones donde la gente son con underlying, tienen enfermedades que le ponen a más riesgo para COVID-19. Pero tenemos casos positivos en todo el condado y en muchos departamentos del condado hay casos positivos y tenemos un departamento de Human Resources que nos ayuda a hacer lo más que tenemos que hacer como employers para proteger a toda la gente que están trabajando con nosotros. Pero no tengo detalles sobre toda la gente que son positivos que trabajan para el condado.
This concludes our press briefing.